Imagine you go to grab your Advil or Tylenol and the bottle's empty, and you don't want to be bothered to drive out to your nearest CVS and get more Advil or whatever you're taking. Now imagine that with a much more significant disease and wondering if you're going to go days or weeks without the medication that is helping you live your day-to-day life. My name is David Fischoff. I am a customer success manager at Infinitus Systems. I was speaking with a customer recently who shared with us a success story where they had submitted a task to Eva for a patient, and while checking up on their benefits, we determined that their prior authorization had been denied. There are a lot of reasons why a PA can be denied, and part of the process is figuring out why and then resolving for it. And in this case, they were able to gather that information from us. We turned it around in about 5 or 6 hours. So that same day, they were able to start working with the healthcare provider to get the appropriate information, correct it, and get those benefits approved for the patient in such a way that they had no disruption in therapy. I am not a clinician, a clinical person in the slightest, but while I'm sitting here at a desk and trying to serve my customers, it is so gratifying to know that at the end of that workflow is a patient receiving the care and therapy that they need and not having to go through the headache of all of these phone calls, all of this administrative work, while also trying to focus on both taking care of themselves, their family, their loved ones, and their day-to-day lives.